treatment in the first sitting only. First, like how we treat the children, we don't start, we just play with them. So that's what I started my first talk. Morning is more plus inning. You start playing means you start talking here. Kids you play, adults you start talking to them. What is the problem? Where is it a problem? How can we solve it? Okay? What is your stress? Why are you stressed so much? How do you do it? Very simple. So patient will tell you. One is patient will tell you. Second is gynecologist will tell you. So when I went to gynecologist, he said 2-3 things. Sir, dentists use a lot of antibiotics. So we don't know what antibiotics. So we tell them not to go for dentist. Then I asked the gynecologist, what is that antibiotics you give to any lady who is having an UTI infection? She said, I give Taxim. I said, I also give Taxim. Simple. I have been giving from past 25 years. So where is the problem? One of the most safest medicine, a broad spectrum antibiotic. You don't have to bother about amoxicillin, don't have to bother about the test dose and things like that. Agree with me? It's the most widely used in US as well. So it's an FDA approved, US FDA approved, Indian FDA approved, everything. Okay, one of the most safest. I have never come across any allergy to Taxi. Okay, and most widely used, and it's available everywhere. You prescribe here, patient is coming from far off also they can go. Okay, you don't have to have your medical store fellow attached to you, right? So that is the first thing. Now coming to that, can't you give antibiotic? Definitely. Then the second question was, she asked me, sir, you take a lot of x-rays. Then I had an interaction with her. It's a big interaction. I said, you also take ultrasound. Sir, no, there is no radiation there. I said, prove me how much radiation you are giving, because each gynecologist takes at least 4 to 5 scannings. Okay, and today we have x-rays which we can take it for even 0.05 second. Agree with me? If you really want to do. But if you really want to do endo, as I said, now keeping this in mind, 15 years back, I started thinking, for the sake of pregnant ladies, something which I can do root canal without taking x-rays. How many of you do it? From start to finish. You know that it is a root canal case, whether it is periodontal, endo-perio or perio-endo. You want to do root canal, or you want to give at least the immediate relief. So there is a formula where I invented to make sure that length would work 100%, almost 90% plus, I can show you, because any invention has to be 60%. Agree with me? 60 to 70% has to be there. So my invention was 90% plus, where I don't take X radiographs and I still can tell you this is going to the apex, and the patient is happy. So these are the conversation I had, right? Third, last but not least, lasers. You can use lasers. If you really want to disinfect, use lasers. I'm not saying to buy hard tissue lasers, buy soft tissue lasers. You can disinfect with a soft tissue laser. There's a process called disinfection. There's a technique called disinfection. There is a technique called dry technique and wet technique, whichever you follow. And there's always a controversy goes on for and against. Okay, now there is against for dry technique. I'm not discussing all those things. If you really want, we have time, then we can discuss. So, laser is the next answer. Now imagine you want to replace. What else? So you can use bloodless, right? Today implants are placed bloodless. We don't have to open flap. How many of you do flapless? Sir does flapless. 2. How many of you do flapless? 3. Why not all of you? Everybody can do flapless. Now under flapless you have many methods. Okay, piezo, I don't know how many of you use. Lasers, you can use. Third, you have osteotomes. Fourth, there is a magnetic mallet which is now launched. How many of you know magnetic mallet here? Sir, you know magnetic mallet. Okay, you know. Sir knows magnetic. So 3 of you. Rest, periodontist? No? You heard. I'll show you what we do. So magnetic mallet is something which is completely bloodless, painless, no suture, no blood, no opening of flap, nothing. You can just treat, put an implant with just your, what is that, Kitrol digit. Is it interesting now? Yes or no?
Yes.
I don't hear yes from all of you. Either you have not understood what I am talking, there's always this, or you have understood everything. Okay, in the back, sir, have you understood what I said? No? You didn't understand? Okay, you can put a question, no problem. We'll move to the next one. See, that is why I keep putting this good morning slides. You have to be awake. So even Dr. Rajshekhar calls me in the night, I'll tell him good morning only. You know, that's my habit to wake them awake. So
He's always awake.
it's it's all about, see, moving on, accepting changes and challenges, whatever I'm talking about, and looking forward to what makes you stronger and more complete dental surgeon. Now, why the word dental surgeon? Why not dentist? We all have done BDS. BDS stands for Bachelor in Dental Surgery. So first of all, you have to be proud that BDS itself you are a dental surgeon. Agree with me, sir?
Yes.
Not saying by me, it's from DCA itself. Okay, so start feeling as a surgeon. Okay, then automatically those who have fear, there are here, I don't want to mention. Since 15 years I've been giving lectures, more than 10 years on implants. My classmates, my seniors, few of them, they don't have that guts feeling to start implant. They say, no sir, so many problems. The screw will lose, this will break, that will break. Come on, your RO is also going to come with that. Everything comes with risk, right? There's a saying in, there's a movie came about, I don't know what's that, he says very nicely in Hindi, risk hai to rizq hai. Risk, that is RIS. Risk hai to rizq. Rizq means food. So if you take a risk, you get a food. So you all have, we take risk, is it? Whether it is endo, whether it is extraction, whether it is ortho, everything is a risk. Ortho, of course, you can play. You do intrude, later you can do extrusion also. No problem. But you cannot do the other way around for other things. Right? So, whatever it is, you have to take a little first step. I had a discussion again with my friend yesterday also. He says, I want to buy, physio dispenser. Can you help me out? I said, okay, which physio? He said, WNS. How much you want to spend? 2.5. I said, boss, spend 1 lakh. 40-50,000 you get a dispenser. 40-50,000 you get a dispenser. And buy implants, 10-20 implants with prosthetics. So I am giving you simple ROI. You don't have to invest 2.5 lakhs and dump it somewhere your, physio dispenser. You can start with a simple physio dispenser. Of course, in cities like Chennai, Bangalore, Hyderabad, we have companies supplying physio dispenser also. But cities like 2-tier cities, people are not going there, the companies are not going there. So it becomes our way of incumbent, to start thinking what I can do